Well, good morning. It's Friday, the 7th of February. And before we go on to the topic of today, I want to talk about Dr. Wenliang, who warned about the new infection on the 30th of December, talking to his colleagues on social media, saying there was a new SARS-type virus and to take a lot more care. This came to the attention of the local authorities, who forced him to recant this statement. It's a pity they didn't listen at that stage. Now, on the 10th of January, he went back to work in Wuhan Central Hospital. On the 10th of January, he developed a cough. The 11th of January, he developed a fever, which is the pattern we have been seeing in this condition. He was formally diagnosed with the novel coronavirus on the 30th of January, and he died on the 6th of February. We believe that's the correct date, yesterday. So our thanks and memories go to Dr. Lee. And he was a scientist. He would have wanted me to point out that from first symptoms to his death was about 27 days. So from being the first onset of the cough to dying was 27 days. And he leaves a wife and 2 children, 1 child not yet born. Right. Now, coming on to news for today, 140 million people are now in quarantine in China, which arguably, of course, is good. It's hopefully going to reduce the spread. Now, just comparing with the SARS epidemic, because I'm going to tell you a few things about Hong Kong next, but the SARS epidemic reached Hong Kong in March 2003. SARS, you remember, is the severe acute respiratory syndrome. Also a coronavirus. It was a new coronavirus. And between the 11th of March and the 6th of June in Hong Kong, there was 1,750 cases and 286 deaths, according to the Journal of the Royal Society of Medicine. So you can see why Hong Kong are a bit sensitive about this. And of course, they share a long land border with China. So medical workers have been on strike in Hong Kong, up to 6,000 a day, demanding border closure and better personal protective equipment. I must say, both of which sound quite reasonable. I believe there's been panic buying of food in Hong Kong as well, because if this virus is a lot of it about, you want to stay home so you're not mixing with people to catch it. Now, in Hong Kong, the world dream is a cruise liner. Cruise liners are notorious incubators for all sorts of disease, often gastrointestinal disease, but in this case, respiratory. It's called the World Dream. It's in Hong Kong. There's 3,600 people quarantined. Now, 8 people who disembarked from a previous voyage on the 19th to the 24th of January subsequently tested positive for the novel coronavirus. So they come off the ship and they were feeling well when they were on the ship. They only became ill and were officially diagnosed by examination of the viral RNA after they came off the ship. So the ship had also stopped in Vietnam and Manila in the Philippines. And now 3 members of the crew have been taken off who are novel coronavirus positive. So these people are now in quarantine, afloat in Hong Kong, one of the Hong Kong harbours. Another cruise ship, the Diamond Princess in Yokohama in Japan, they've got 1,045 crew, 2,666 passengers, and 61 new cases after 6 days. So they've been quarantined now. And after 6 days, 61 new cases, 61 new people have proved positive for the novel coronavirus. The background here is in January, an 81-year-old developed the virus after getting off the ship in Hong Kong. So again, this is someone who'd been on the ship, feeling well when they were on the ship, then got off it, but had left the virus behind them. Now, whether the virus was left on surfaces, if there was parts of the ship that weren't cleaned, and it was surface to mouth or surface to eyes contamination, or whether it was members of the crew that caught the infection, we don't actually no. But 61 people are positive, so it may well be that more people prove to be positive that are currently in the incubation period on that ship. Now, news today. Confirmed cases, Johns Hopkins website, 31,520. Confirmed deaths, one of whom is Dr. Lee, 638. 1,733 recovered, 28 countries. What the real figures are now, we're into the realms of speculation. We've covered that on previous videos. Now, the subject I want to talk to you today about is infectious disease. Now, infectious disease has been known about for a long time. And as we've looked at in this video series, there's a lot of things we do know about the novel Wuhan coronavirus, but there's a lot of things we don't know. So I want to give a bit of background now about the principles of infectious disease, as we've given hopefully useful background in other videos. Now, in 1884, the famous German pathologist and microbiologist Robert Koch put forward his postulates, Koch's postulates. Now, what this means is, this is the way that we can decide whether a disease is transmissible or not. And it also allows us to prove whether a disease is transmissible. So, for example, Barry Marshall proved this with the Helicobacter pylori, proving that peptic ulceration could be a transmissible disease. But we'll look at it in the context of the novel coronavirus. Now, what Robert Koch says was you have to be able to identify the disease from all people with you have to identify the microorganism for everyone with the disease. So the microorganism should be found in all cases of the disease. Then you should be able to culture the microorganism outside the body in an independent culture. Then you should be able to take a healthy subject, reintroduce the organism, and that should cause the same disease in the healthy subject as in the sick subject. And then you should be able to take samples from the second sick person, culture those, and prove it was the same organism as occurred in the first disease. So that's Robert Koch's postulates. So what he's saying is, you have one person with the disease here, and you take cultures from them, and you grow them up. And he was using bacteria, so he grew the bacteria up in culture, like that, grown up in culture. And you can identify the organism now from this culture. And then you take this bacteria from this person that you've grown up independently, or the virus in this case, and you inoculate that's the right term, inoculate into a second person. And that second person was previously healthy, but they get the disease. So person 2 has the same disease as person 1. You'd expect a roughly similar clinical picture. Then you take samples from person 2, and again you culture that up in your culture disc, and you grow the same organism. That's what proves a disease is infectious. But it also tells us some interesting principles about the nature of infectious disease. And I'm going to try and illustrate these with the example of the Wuhan novel coronavirus. But let's just whiz through these first of all. The microorganism must be found in all subjects suffering from the disease. That's the first one. He suffers from the disease, but should never be found in healthy subjects. So we could have included that. So if you take samples from a healthy subject, they won't have that organism. It's just subjects of the disease that have it. The microorganism must be isolated from a diseased subject and grown in pure culture, which was done there. The cultured microorganism should cause disease when introduced into a further healthy subject. That was person 2, or subject 2. And the microorganism must be isolated from the inoculated, diseased experimental host and identified as being identical to the original specific causative agent. That's there. So those and those are the same. So those two have the same disease. Those two are the same cultures. Now, I really do hope this hasn't been done with novel coronaviruses. There's certainly nothing in the literature about it. But we'll have to work out what we can know. So samples were taken from an early cluster of patients, and the samples that were taken were respiratory samples, and they even went to the extent of taking washouts from the alveoli, from the lower part of the lungs, getting the virus in that. Because what happens is when the virus is on the surface, so here we have the imagine this is the respiratory mucosa with the line of respiratory epithelial cells here. And you might remember that there's often these cilia, these hair-like structures, hundreds of them per cell, that waft the mucus. And there will be a layer of mucus being wafted up towards the trachea to be coughed out. Well, when the viruses grow inside these cells, because remember, viruses are obligate intracellular parasites, but when the cells have grown a lot of the virus, they bud from the top, and you get free viruses in the mucus. That's then coughed up, and of course that's why it's transmissible, because these viruses will then be coughed out into the environment. So you can swab the infected surfaces directly, or you can look at sputum that's been coughed up from the lungs, and it's also been found on the mucous membranes of the upper respiratory tract and in saliva. But it just shows that the virus gets onto the surface. So when they took samples from here, they collected samples of the virus. So they'd fulfilled that first postulate of Robert Koch, that they'd identified the virus from lesions of the case, from people with the condition. And this was sent to the Centre for Disease Control in China. And now, the thing about viruses is you can't grow them on an agar plate like you can bacteria. Viruses can only grow inside living cells. They are obligate intracellular parasites. So what they did was they actually had a culture of cells which were very like human epithelial cells, and they inoculated these cells with the virus, and they grew the virus up in these cells. So this was the equivalent, or the viral equivalent, of growing them up here. But because it's a virus, they had to grow them up inside the cells. And then the virus proliferated inside. So they took the virus from the respiratory tract, put it into these new cells in culture, and grew up the virus. So they've grown up the virus from that. So they'd fulfilled that stage of Koch's postulates. They'd identified the organism and they'd cultured the organism. So the first two postulates there were met, really. And they recognised that this organism wasn't MERS or SARS. And Robert Koch would do his identifications with a light microscope, but today they do genetic analysis of the RNA of the virus, which is very accurate. So we know that it was this same virus that came from the people that were grown up in the cells. We know the name of the new virus now, 2019 novel coronavirus. And we know previously we've said 4 coronaviruses cause the same cause cold symptoms. So there's 4 coronaviruses cause cold symptoms. There's one causes MERS, Middle East Respiratory Syndrome. One causes SARS, Severe Acute Respiratory Syndrome. And now this 7th one causes the novel coronavirus infection. Now, as I've said, I'm pleased to say that as far as I know, no one has been deliberately infected with this virus. But we do know that there's been cases of spread of the virus to other people in person-to-person transmission. We do know that. So the spread has actually been demonstrated. So I'm happy to say that Koch's third postulate has been demonstrated, because the similar disease as a result of this contamination, this viral contamination, has caused a similar disease in person 2 compared to person 1. And in people that have caught the disease from other people, again, samples have been taken. For example, this work was done in Australia as well as originally in China. cultured up in other living cells again, living cells in culture, and again the virus was grown up. So the virus has been re-identified from people accidentally inoculated, not from people deliberately inoculated, I'm pleased to say. And again, this virus was analysed genetically and found to be the same virus. So the disease is the same in 1 and 2, the virus is the same in culture 1 and in culture 2. So Koch's postulates were met. So we are dealing with a disease of this type of infectivity. Robert Koch would be happy that this is an infectious disease. Now, the trouble with viruses is there's a lot of genetic drifting and shifting. So viruses are actually changing all the time. So you get minor genetic changes in the virus. But sometimes you get a shift, which looks like it's occurred in this novel coronavirus, which has caused the possibility of the jump from animals to humans. We don't know which animal yet. Probably came from bats to that animal, but we don't know the animal. We don't know the natural reservoir yet. That's caused this cross-species infection. So there's probably been one mutation already, giving rise to this cross-species infection, which we call the spillover infection. So that's just some principles of infectious disease that we can apply to our study of this novel coronavirus, just to help our background understanding a bit. One of the things that does concern me, as well as the general spread of the virus, one of the things that concerns me is the possibility of more genetic mutations. Now, if there are further genetic mutations in the virus, it won't necessarily make it more infectious. It won't necessarily make it more virulent, but it might. It might, so that is a risk. And the more people that are infected, the more copies of the virus exist, and the greater the probability that this will happen. But fortunately, it looks like the levels of mutation in the virus so far aren't particularly significant, but the virus does continue to spread. And as we've seen, two major factors in spread are modes of transport, cruise ships and international travel, as well as other modes of travel like buses. I'm sure that was a factor in Wuhan in the initial spread. So there we are, Robert Koch's postulates and the principles of infectious disease as we remember the life of Dr. Lee.